Let's take a closer look at the critical environment gloves used during hospital pharmacies' drug compounding. Compounding is generally a practice that a licensed pharmacist does in the hospital to create a medication tailored to the needs of an individual patient. Although compounded drugs can serve an important medical need for certain patients, they also present a risk to patients from unsafe, ineffective, and poor quality compounded drugs. While drug compounding is important and useful for patients, several tragic incidents of patients' injuries and death have been reported during the past decades. Issues with drug quality, stability, and sterility, as well as maintaining a controlled, sterile environment, are risk factors. Because of this, the FDA began stepping up its oversight of compounding pharmacies in response to a 2012 fungal meningitis outbreak that sickened more than 750 people and resulted in more than 60 deaths. The reason was an injectable sterile drug product. Let's clarify the difference between non-sterile versus sterile pharmaceutical compounding. Non-sterile medications include the production of solutions, suspensions, creams, powders, suppositories, capsules, and tablets. Sterile compounded medications, on the other hand, are intended to be used as injections, infusions, or application to the eye. The main different reasons for sterile compounding contamination is visible contaminations in the compounding area, failure to monitor the environment to ensure proper pressure, temperature, and airflow, improper aseptic working technique, and improper clothing or the use of non-sterile clothing. One of the primary safeguards that life science companies and the industry use to help prevent contamination in cleanrooms operation is gowning. Gowning is basically putting on working clothing. In this case, layers of specifically designed garments, covers, masks and gloves that isolate your body from the cleanroom environment. The gowning process is based on the sensitivity of the work environment. For example, gowning in Grade A pharmaceutical fill suite operations is going to be much more rigorous than gowning for a Grade D packaging operation. We will now focus on the critical environment gloves worn to protect the hands, as well as the products when working in a controlled environment. To use high-quality gloves in hospital pharmacies is just as important as in the operating room, but the requirement for particulate count is more stringent than for the surgical gloves. Therefore, our Biogel Tech gloves are packed in a different way. At last, we will follow the gloves and how they're unpacked in different stages for final use. Opening of the transport box. The cardboard box will be dirty on the outside. It is therefore important to protect your clothing by using a plastic apron, for example, as well as protecting the plastic bags inside the transport box when opening the box and unpacking. The sterile barriers are packed 25 pairs in a plastic bag. 2 of these bags are then packed into another plastic bag. Altogether, 200 pairs of gloves fit into each transport box. This packaging configuration meets the needs of a critical environment such as the hospital pharmacy. Be careful not to touch the plastic bags with contaminated hands. Before you unload the plastic bags, make sure your hands are disinfected. Place the bags on a clean, disinfected surface. When opening the outer plastic bag, we recommend that you use a pair of scissors. Start with the edges to minimize the risk of contamination. Fold the cut plastic without touching the inner plastic wrap, using an outer-to-outer technique. The inner plastic bag is comparable to the retail box used for surgical gloves. Disinfect your hands before you place the 25 pairs still in its plastic bag on another clean, disinfected surface. The gloves can be stored in the inner plastic bag or unpacked and placed in a storage box. Again, scissors can be useful to cut the plastic bag at the bottom to allow easy loading of the storage box. The gloves can now be stored closer to where they will be used.